From anesthetic gases to certain inhalers, medical care can produce a surprising amount of emissions.
We know that healthcare contributes about 5% of Canada's greenhouse gas emissions in total, so we can do a lot within healthcare to lower those emissions.
This week, international anesthesiologists released a consensus statement calling on anesthesia providers to use gases with the lowest global warming potential.
We use this to either deliver oxygen and/or anesthetic gases.
This Toronto anesthesiologist says some commonly used gases are falling out of favor.
For those that are environmentally inclined, one would want to choose the least offensive to the environment, because of course we use these all day, every day.
Here's how two anesthetic gases compare. An hour using desflurane equals a roughly 370-kilometer car trip. Swapping to an hour of sevoflurane is like a 50-kilometer ride instead. Or, in some cases, medical teams can opt for intravenous anesthetics instead. This physician says patients can also have a say in reducing emissions tied to their care.
For Canadians who use inhalers, so there's a couple things you can do to reduce the impact of the inhaler on the climate.
For one thing, she says you can ask your doctor about switching from a metered dose inhaler to a dry powder inhaler. And
if you have an inhaler, make sure you've had proper breathing studies that show what your diagnosis is. If you don't have a diagnosis and you're puffing away when you, for example, have a cold, that's probably not a very good reason for puffer use.
All small changes, but climate-minded physicians hope they add up to a big impact. Lauren Pelly, CBC News, Toronto.